what I am trying to show you is an instrument which is generally used, a common instrument used in all the surgeries. The proximal end, which has got, if you see proximal end, it has got the two rings, and if we apart it, we will see that near the proximal end, which has got the two rings, and near the two rings we have the locking system, which is the ratchets are there. You see, you can see 1, 2, 3. So these ratchets are the locking system. When we want to lock the instrument, we will lock it with this. And then if we look at the full length of the instrument, it's about 8 to 10, 11 inches long instrument, and the between the the distal end, if you look at the distal end, I would like to show you the distal end, how it looks like. So this is a distal end, and this is fenestrated, and the blades are flattened and fenestrated, and the inner side of the blade, that's what I would like to tell you, that it has got the transverse serrations. So that's what is the important thing one should see. So it has got the transverse serrations here. These are the and these are the transverse serrations here. So you have serrations over here. So the inner of the blades, the distal end, has got the transverse serrations, and the transverse serrations. Now I hope that now it is clearly visible. You see, these are the transverse serrations. I'm very closely going to the blade, near the blade. So this is what the inner side of the blades or the transverse serrations are there, so that anything held between these two blades will be held properly and will not slip away. The instrument is generally used for the cleaning purpose in the beginning of the operation, just prior to the operation, when preparing the skin. So for the skin preparation, we are using this instrument, and the distal end, which is fenestrated and has got the transverse serrations, and the gauge piece that is to be placed between these two ends, between these two blades, and as I said, it has got a locking system. So it will, here, these are the ratchets. You see, these are the ratchets, and it locks. So these ratchets, it locks the instrument so that the thing which is held here in the blade never slips away. Fine. So you have the locking. You can hear that ratchet sound. This is what a locking sound. So this instrument is used in the beginning of the operation, cleaning the areas and around the area of the surgery. Normally, for the cleaning purpose, we will be keeping the 3 sponge holders on the instrument trolley. So one will be used in the beginning for the cleaning purpose of the skin, and it will be discarded, and the other 2 sponge holders, that will be kept, and on the tip we will be mounting 2 surgical gauze on each, one surgical gauze in one sponge holder and another surgical gauze in another sponge holder. So these will be used for the gauze dissection, or applying the pressure somewhere where the bleeding is occurring, or somewhere wherever you want to apply the pressure. So that's how, in brief, the instrument is a long instrument, about 8 to 12 inches, 10 inches long, and the proximal end has got the 2 rings. The 2 rings, near the 2 rings, we have the locking system, which is the ratchets are there, and so that we can lock the instrument. Between the proximal and the distal, we have the junction box. So beyond the junction box towards the distal end. The distal end has got the two fenestrated blades, and they are inner side, they are serrated. Can you see these serrations? I have given a very clear look now. So the serrations are there, transverse serrations on each blade, so that the grip is nice and it never slips the thing which is held within the blade. So in the beginning of the operation, we are using this instrument. Thank you very much for learning this instrument, and the next instrument will be taking, that will be the needle holder. Thank you.